If you are fasting with high blood pressure, the biggest risk is not the fast. It is changing your blood pressure medication without a proper plan. Now that is how people end up dizzy, dehydrated, or suddenly just uncontrolled. And the most important part is not what you think. We'll come to that near the end. Assalamu alaikum, my name is Dr. Azad. I'm a medical doctor and a pharmacist based here in the UK. So there was this one patient who felt proud that he had reduced his tablets in the first week of Ramadan. He said he felt lighter and assumed his blood pressure was much better. But 3 days later, he nearly fainted and his readings were unstable. And here is what we discovered. What most people think is simple. If I'm eating less and losing weight, my blood pressure is bound to improve. So they think maybe I need less medication. And here is the main point. Blood pressure medication does not work meal by meal. It works over a 24-hour period. Medicines like amlodipine, which relax blood vessels steadily. ACE inhibitors, for example, pril, which reduce pressure by changing hormone signal within your kidneys. You also have your diuretics, that shift fluid balance. Now, add 16 hours this year without fluids. The same dose can feel stronger. And that is why dizziness appears when standing. This really matters because NICE guidance, the guidance that we use here in the UK, is clear about one principle. Do not stop or alter doses abruptly. Here is the second issue. During Ramadan, hydration patterns shift. Your fluid intake is compressed into less hours in the day. If you are on diuretics such as benzoflumethiazide or furosemide, urine output will increase. That can exaggerate dehydration. Certain studies looked at Ramadan fasting and blood pressure trends and showed readings fall in some individuals, but not everyone. And that variability is the main danger. Repeated instability in blood pressure stresses blood vessels. Another study reminded us that consistent control reduces cardiovascular risk over years. So the goal is stability, not short-term guessing. This is how I would tackle this. The main solution would be, first, book a medication review with your GP or with your pharmacist. Not in the first week of Ramadan. Do it a week before. Now here, timing can be adjusted very safely. Dose changes should only happen under supervision. Don't change it yourself. Second of all, monitor at home during the first week. So morning and evening, check your blood pressure. So let's say suhoor time and iftar time. If systolic readings fall near 100, the top number, and you feel symptomatic, meaning you feel lightheaded, dizzy, feel like you're about to faint, do not push through. Please seek medical advice. So the third tip, hydration strategy after iftar really matters more than you think. Spread fluids gradually. So you pray, you'd have iftar, and then you'd be present in your night prayers. That would be a perfect opportunity to take a small 500ml bottle with you and just sip it between each prayer. And here is a counterintuitive part. Do not assume weight loss in week 1 means you need less medication. Blood pressure adapts slower than appetite. With transformations before, you might have thought fasting automatically improves hypertension. But now you understand the biology, you understand the timing, and you understand the risk of random changes. So now you know the things that most people don't get told. And please act on it. That's all for today. Thank you for watching. Ramadan Mubarak. Please remember my father in your prayers. Inshallah, I hope you have a lovely Ramadan and I'll see you in the next video. Take care. Assalamu alaikum.